Um, this is a step-by-step guide to the root canal procedure. What is a root canal? A root canal is also known as endodontic therapy. It's a process of taking out damaged and infected pulp within the tooth and stabilizing the tooth. As we've discussed before in class, when the pulp, which is the interior of the tooth, becomes infected or damaged, bacteria can spread from the infected area into your gums and even into your jawbone, and it can also be transported to your heart. Without treatment, the tooth will die, and then you'll end up having cavities. You would have to have the tooth extracted. It would just cause more damage to the surrounding teeth. All right, so here's a little video, but I wanted to show y'all over here. This is the necrotic pulp decay. So this is a cavity in the tooth right here, and then your infection is down here. So when the root canal is done, it's cleaned out and it's filled back in, and we're going to talk about that in just a second. Okay, so the root canal procedure, here's a step-by-step guide to how the root canal procedure is done and exactly what needs to happen and why. So first of all, when you do a root canal, it's going to be local anesthesia is given to numb the site and the surrounding area. The doctor will wait to begin until the area is completely numbed. Step 2. This is when the doctor or the dental assistant will apply the rubber dam or the dental dam. It's a thin sheet of rubber or vinyl that allows the dentist to concentrate on a specific tooth, and it blocks it from the other teeth. It creates a sterile environment, and it keeps the risk of the infection traveling to the rest of their mouth. Step 3, drilling. In order to access the dead pulp chamber, a small hole is drilled into the affected tooth. Depending on which tooth it is, it could be on the occlusal surface for posterior and on the lingual surface for anterior. Step 4 is removing tissue and the nerves. So special root canal tools are used to remove the dead pulp tissue and nerves. At this point, the affected tooth will no longer be able to feel pain at all. Step 5, disinfecting. This is one of the most important steps in the procedure, is disinfecting the inside of the tooth, the canal. All right, so this is like just a little video for y'all, and y'all can watch it later. I'm not going to play it now, but this is going to kind of go through filling of the tooth and how it's done. Okay, step 6, inserting flexible root canal tools. So this is going to be your drills, your hand files, and it goes in and it removes any debris or anything like that. And then once you've cleaned it out and the tissue is gone, then you're going to do step 7, which is apply a filling. A rubber-like thermoplastic filling material, which is called a gutta-percha, is applied into the root canals and is set in place by an adhesive cement sealer. The sealer is very important to keep the tooth from becoming reinfected later. Step 8, if needed, a post may be inserted. Depending on the structure of the affected tooth, a post may be inserted into the root canal during the filling process to hold the temporary or the permanent filling in place. If you receive a temporary filling, it is very important to come back for a permanent filling or crown to reduce the risk of infection down the road. So if more than 3/4 of the crown surface of the tooth is missing, then they're going to have to put a post in the tooth. You can only have a post if the tooth has had a root canal. So in most cases, an antibiotic will be prescribed to treat any remaining infection. It is common to feel some minor pain and discomfort after the procedure, but it should only last a couple of days. So the problem with this is that when you give a patient antibiotics and pain medicine when they come in for a toothache, and you tell them they have to have either a root canal or have the tooth extracted, they decide, okay, I want to keep my tooth. So you give them pain medicine and an antibiotic, and they go home. So they take their antibiotic the first day because they're in pain, and maybe even the second day. But then they keep taking the pain medicine and they stop taking the antibiotic, and the antibiotic is really, really vitally important. So us as dental assistants, we need to step up and make sure that the patient understands that they must absolutely finish their antibiotic when they are prescribed to them. Okay, so when a patient comes in for a toothache, there are some certain tests that we can do to see if the tooth is vital or non-vital. So vital means it's living, it's not dead. So how you test that is, these are two different types. I just wanted y'all to see the difference. This one hooks in their mouth around the tooth like a hook on their lip. And then this actually goes and it touches the tooth, and it'll send like a little electric pulse into the tooth. And that'll let the patient know. If the patient feels it, then the tooth is vital. And it lets you like change the settings and crank it up to where they feel more to tell how vital the tooth is. This one works the same way, only you don't have the hook. So these are inserted into, and this is your little dial, and you just turn it up and touch it. Now you have to have a conductive medium to go with this. So you use a little toothpaste and the doctor will dip it in there and then put it onto the tooth. All right, so dental tools used in a root canal. A basic examination and diagnosis consist of a mouth mirror, suction tip to aspirate water, of course, any saliva, and these are easy to get underneath a rubber dam. You can still use the high volume on top, though. You must take an x-ray before and after the procedure is completed. There are a couple of different reasons why. First of all, you need the root canal. If the patient has insurance, you need to take the x-ray of the tooth prior to having any treatment done to it so that you can prove that it needs to have a root canal. Second, it gives the doctor a visualization, and they can also use the computer to measure on the x-ray how deep they need to go, and it's a bunch of different things. And then at the end of the procedure, you need to take a final x-ray so that the doctor knows he got all the way to the apex of the tooth, and to also send to the insurance company to prove that the work was completed. So instruments which are used during isolation and access of the cavity, of course, you're going to numb the tooth. And this is your syringe, and then you have your needle and your anesthetic down here. That's to numb the patient. And you're going to apply topical before that. All right, you need your tweezers, are, as we call them, cotton forceps. You're going to use this for many different things to take things in and out of the patient's mouth. All right, you're going to place a rubber dam, which is used to isolate the tooth and allow visualization, keep bacteria away from the rest of their mouth like we talked about before. And this is just a picture of what it kind of looks like so y'all can see. All right, a rubber dam clamp. All different shapes, sizes, depending on which tooth you're working on. You're going to need a high-speed handpiece with endodontic burrs, which are created to access openings to locate the root canals in the orifices. All right, this is a sharp explorer. This is going to use, it's just a regular explorer on this end. Okay, but over here you have an endo explorer. All right, instruments which are used to clean and shape. So you need your endo file holder and an endo ruler, which is your ruler is right here, and you're going to stick your endo file here, and your little rubber stopper goes here, and the doctor can measure and see how deep you went. And that's where you get your working length. Remember, we have to write down our working length. Okay, these are Gates Glidden drills. They're used, they come in 2, 4, 6, 8, and you can see they're like it gets bigger as you go. And you can also count here. the little rings, and this will tell you 1, 2. So you're going to use this to open up or gain access to a canal that you can't see. These are your brooches. They're made of stainless steel, and they're used to remove the nerve. So even though you remove the nerve, you still have to clean out the debris around it. And that's where you use your endo files. Files are usually like they have, see, 25 millimeter. That'll tell you how long it is, and it goes in sizes, and the doctor will start at a size and he'll go up. So this is going to tell you, I mean, these are used to smooth and clean out any debris that's left down in there. They come in many different sizes, and normally they're color coded, and these are called hand files. And you do have some that go on a handpiece, but these do not. The doctor uses them with his fingers. This is going to be an apex locator. Not everybody uses this. Some people use just the x-ray. There's lots of different things that you can use when doing a root canal. This is just one, like a modern technology that they use. And this clamps around the file that I just showed you. And the doctor can insert it into the tooth, and it'll tell him when he gets to the apex of the tooth. It's kind of like a little speedometer. It'll go do 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 do. Okay, so now you're going to irrigate. Once he gets it all cleaned out and he makes sure he's at the apex, you want to use anything sterile. It has to be sterile. Saline, they can use anesthetic. They can use all different kinds of things. Some doctors even use bleach to flush the canals out. And this is an irrigating syringe. I showed you the needle a while ago, but this is the syringe that you put the material in, the solution in. And then once you clean it out, you have to dry it. So you're going to use these paper points, and they're different sizes. And he might use more than one. Most of the time they use at least 4 to 6 in a common root canal, but you could use more depending on how many canals there are in the tooth. He's going to use this. At this point, you really need to be paying attention to whether it's coming out clean or whether they're coming out dirty. So the first 1 or 2 is going to be dirty, but the more he cleans and dries out that canal, the cleaner the paper point should be. That's going to be important because you cannot seal a tooth if it's still infected. Remember a while ago when I was telling y'all how vitally important it was for the patient to take the antibiotics. So if they don't take their antibiotics, once you open it up, it's still going to be infected. So if it's still infected, you would stop the procedure. At that point, you would not go any further with sealing it or anything. You would take 2 little cotton balls. One has formicrosol on it, insert it into the tooth, the dry one on top, and you would put a temporary filling in the tooth, send the patient home on antibiotics. If it comes out clean and clear, then you can continue the procedure. You would go to your endo sealer. So, comes out clean, you're going to move forward. The sealer is what seals off the tooth and holds the gutta percha in place. And I put 2 different kinds on here. This is a self-mixing, and this you have to mix 2 parts together. Okay, so some doctors, they do a lot of different ways. Like I said, there's a lot of different techniques. So some doctors like to use a spiral drill, and they will insert the drill into the sealer, and it like picks up the material, and then they'll like spiral it down into the canals. Then they're going to use a plugger. This is going to use, you're going to use this to push your gutta percha into place. You can also use a spreader. Now here's your gutta percha. So you're going to take your gutta percha, you're going to put it either into the sealer, or the sealer is going to be placed in the canal. You place the gutta percha into there. This serves as a fake nerve. That's a good way to think about it or remember it, is that once you take the nerve out, you cannot leave a space. Everything has to be filled up within that tooth, because if it's not, it's going to allow bacteria to re-enter the tooth and become reinfected. So place the gutta percha. And this is going to show y'all what it's going to look like with the gutta percha sticking out. So we can't leave it like that. So now we're going to use a gutta cut or a glick. A gutta cut, it has like a little, it's kind of like a soldering gun, kind of like, but you push the button and this heats up and it burns that gutta percha off. Then over here, you can heat the glick up, burn the gutta percha off, and then use the other plugger in to condense it down. This is a closer up of the plugger, and this is a Woodson, also called as a Woodson. This is what you're going to use to place your temporary filling material in, which is going to be your cavit. So this is what it looks like, an x-ray of your gutta percha sticking out. We're going to burn those off, and then we're going to put cavit over the top. You have to fill in that hole that was put there. If not, the patient's going to pack food. It's not going to stay in. It's not going to work out, and it's going to get reinfected. So we need to make sure to put a temporary filling material in it. Now, you can move forward, and like I said in the beginning, some dentists like to go in and put a post in or a permanent filling. So it all depends on the patient, the procedure, the tooth, the case scenario of what's happening. After a root canal treatment is completed, a permanent restoration will be placed on the cavity created earlier to restore the loose tooth structure. Further treatment, such as a crown, you can also do some bleaching internally. If it's on an anterior tooth, depending on how much of the tooth structure is lost and how severe the tooth is discolored. All right. Thank y'all.